Welcome to this week's Al-Ghaf Dynamics Health Connect Middle East podcast episode. This week, we will be discussing major developments and events over the past 7 days in the Middle East region across healthcare, public health, life sciences, and wellness. Areas that are not only important to the Middle East population, but to the regional ministries, organizations, hospitals, pharmaceuticals, biotech, and wellness groups. You will hear trends, insights, and the latest developments across the Middle East region for the week leading up to August 28, 2025. As always, our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets coupled with our internal data and analytics platform, Health Connect Middle East. The week of August 21 to 27, 2025 showcased a dynamic Middle Eastern health landscape defined by bold policy moves, innovative research strides, and persistent public health challenges. Governments across the region accelerated healthcare reforms, from cutting medicine costs to forging international partnerships, underscoring a commitment to stronger, more accessible health systems. At the same time, local institutions and researchers pushed the envelope in life sciences and digital health, signaling the region's growing contribution to global medical innovation. Yet these advances unfolded against a backdrop of enduring challenges. Conflict and humanitarian crises continued to strain health services in areas like Gaza, Syria, and Yemen, while economic pressures tested systems in countries such as Lebanon and Iran. First, our healthcare policy and government initiatives from the past week. Governments in the Middle East drove significant health policy initiatives during this week. In Qatar, the Ministry of Public Health enacted sweeping pharmaceutical price reductions, cutting costs of 1,019 medications by 15 to 75% to improve affordability. The discounted drugs span many therapeutic areas, from heart disease and diabetes to cancer treatments, reflecting a policy focus on easing the burden of chronic disease management. Qatar's Pharmacy and Drug Control Department stressed it will continue reviewing prices of essential medicines to ensure broad affordable access, aligning with the country's sustainable healthcare development goals. In Saudi Arabia, international collaboration was a highlight. Health Minister Fayed Al-Jalajel concluded official visits to New Zealand and Australia aimed at strengthening bilateral healthcare ties. Discussions in New Zealand centered on integrating Saudi Arabia's successful digital mental health and telemedicine programs with Kiwi systems and exchanging expertise on patient-centered care and workforce development. These high-level exchanges support Saudi Arabia's Vision 2030 objectives by opening avenues for cutting-edge health system improvements and global partnerships. Meanwhile, Kuwait introduced a notable policy change affecting healthcare access. Authorities announced that effective immediately, visitors on temporary visas are barred from using public hospitals and clinics, which will now be limited to citizens and resident expatriates. This move, directing short-term visitors to private facilities, is intended to reduce strain on Kuwait's public health system. Concurrently, Kuwait's Ministry of Health launched a nationwide health survey awareness campaign to gather data on population health needs, indicating a drive towards evidence-based policy planning. Elsewhere, Oman addressed healthcare governance and workforce issues. The Ministry of Health in Muscat publicly clarified an internal promotions dispute after withdrawing certain employee promotions as part of standardizing HR procedures. The ministry reaffirmed that staff rights would be protected and explained that the review was aimed at ensuring fairness and motivation across the health workforce. By proactively managing human resources policy, Oman seeks to maintain a stable, merit-driven work environment in its health sector. In Bahrain, policy attention turned to professional engagement and quality of care. On August 21, the health minister met with the Bahrain Medical Society's leadership to discuss collaboration and support for medical professionals, underlining the kingdom's commitment to empowering its healthcare workforce. Additionally, Bahrain's Supreme Health Council chairman conducted on-site visits at Salmania Medical Complex to review services and infrastructure, reflecting a governance initiative to ensure hospital standards and patient care remain high. Notably, regional cooperation featured prominently. Yemen and Jordan took steps to strengthen bilateral medical ties during meetings in Oman. Jordan's health minister, Dr. Ibrahim Al-Buda, affirmed readiness to facilitate treatment for Yemeni patients in Jordanian hospitals. Both sides discussed expanding a program for Yemeni doctors to train in Jordan as residents, which would bolster Yemen's healthcare human capital while giving Jordan's system a humanitarian role. This diplomacy highlights how Middle Eastern governments are using partnerships to bridge healthcare gaps in conflict-affected states. Even amid Yemen's ongoing crisis, such agreements aim to improve access and capacity for vulnerable populations. Across the region, these policy and governance initiatives share a common theme, leveraging reforms and partnerships to build more resilient health systems. From cost regulation in the Gulf to workforce development and cross-border aid, Middle Eastern governments are actively tackling structural issues. While approaches differ by country reflecting varied economic conditions and health system maturity, the week's developments demonstrate a collective recognition that effective policy and government leadership are essential to improving health outcomes for their populations. Next we have life sciences and research innovation. The period saw the Middle East's research and innovation engine in motion, with several countries advancing life sciences initiatives. In Qatar, a hub of biomedical research, Sidra Medicine took center stage. The Doha-based Specialty Hospital and Research Center announced it would host its first disease modeling and therapeutics conference on August 26, bringing global experts together to share insights on using models, from cells to AI simulations, to develop new treatments. Around the same time, Sidra Medicine also unveiled a partnership with the US-based Rady Children's Institute to launch genome-based newborn screening in Qatar. This initiative, Begin NGS, will use advanced genetic sequencing to screen newborns for hundreds of treatable inherited disorders. By moving toward comprehensive genomic screening of infants, Qatar is positioning itself at the forefront of precision medicine in the region, aiming to detect conditions early and personalize care for its youngest citizens. Elsewhere, Egypt signaled progress in life sciences and industrial research through its focus on pharmaceuticals. The Health Ministry convened a high-profile committee to boost pharmaceutical research and exports, part of a strategy to transform Egypt into a regional medicine production hub. Officials reported plans to create a specialized body for promoting drug exports and to integrate scientific and manufacturing expertise to meet a target of $$5 billion in medical exports by 2030. This includes harnessing Egypt's R&D capabilities in developing generic medicines and vaccines, as well as leveraging its network of medical missions in Africa. The strategy's technical working groups, pending cabinet approval, will address regulatory streamlining and market analysis, which in turn should encourage research investment and innovation in drug development. By coupling research-driven production with aggressive export goals, Egypt is seeking not only economic gain but also to contribute to health security in the global south with affordable therapies. In the United Arab Emirates, although much of the week's headlines were on policy, the country's earlier investments in longevity and personalized medicine continued to reverberate. The UAE has rapidly emerged as a regional leader in longevity science, exemplified by Abu Dhabi's hosting of global gatherings on precision medicine and the establishment of the world's first licensed longevity research center. While these particular milestones occurred prior to this week, their influence persists. The principles outlined, such as investing in genomics, AI-driven diagnostics, and cross-disciplinary innovation, are increasingly guiding health research agendas across the Middle East. This week's flurry of conferences and collaborations in Qatar and Egypt are indicative of that trend. In sum, the Middle East's life sciences sector exhibited both scientific ambition and collaborative ethos. Countries like Qatar are leveraging their state-of-the-art facilities and academic partnerships to push the boundaries of pediatric and genomic medicine. Others, like Egypt, are channeling research into tangible industrial and public health benefits, such as local drug manufacturing for regional needs. These efforts are steadily integrating the region into the global scientific community. As these programs bear fruit, they promise to not only improve healthcare within the Middle East, but also share innovations, from genetic screening protocols to new therapies, with the wider world. Biotech and pharmaceutical developments are up next. The biotech and pharmaceutical industry saw robust activity, with Middle Eastern nations balancing domestic needs and global aspirations. Egypt made headlines by aggressively advancing its pharmaceutical sector strategy. Health Minister Khalid Al-Ghaf chaired an inaugural meeting on expanding Egyptian pharmaceuticals access to global markets, as per a cabinet statement. Key outcomes included progress on forming technical subcommittees and an executive office to implement export plans. Egypt's foreign ministry is backing these efforts. Embassies have standing orders to promote Egyptian medical products and even health tourism abroad. The plan, which aims for $5 billion in medical exports by 2030, involves establishing a specialized promotion body and streamlining customs and regulatory procedures. By aligning government ministries and analyzing target markets, Egypt is effectively merging biotech industrial policy with diplomacy. This indicates a clear intent to transform Egypt into a regional pharma manufacturing powerhouse, capable of supplying medicines and vaccines to Africa and the Middle East at competitive prices. In the Gulf, investments in biotech and medtech continued at a rapid clip. Abu Dhabi, already home to new genomic, vaccine, and health tech initiatives, recently unveiled a major medtech and biopharma initiative aimed at solidifying the UAE's role as a global life science hub. During the Abu Dhabi Global Health Week, officials showcased a bold vision to attract investment in biotechnology and digital health, complementing the UAE's progressive regulatory framework and world-class research infrastructure. While that medtech launch occurred earlier in August, its momentum carried into this week as partnerships and deals begun their proceeded to execution. The initiative underscores how the UAE is capitalizing on its strong economy and innovation-friendly policies to foster a vibrant biotech ecosystem that can develop new therapies and health technologies. Qatar's decision to slash medicine prices also reverberates in the pharmaceutical domain. By reducing prices on over 1,000 drugs in the local market, Qatar is not only providing immediate relief to patients but also potentially reshaping market dynamics for pharmaceutical companies operating in the region. Many of the affected products include treatments for chronic and complex conditions, for example heart disease, cancer, immune disorders. This wide-ranging price reform, implemented in coordination with pharmacies and importers, could prompt manufacturers to reconsider pricing strategies and encourage more competitive generic options. Over time, Qatar's approach may serve as a model for neighboring countries grappling with rising drug costs. Indeed, Iran faces an acute version of that challenge as its currency plunged to record lows this week. A state-run Iranian outlet warned on August 25 of imminent spikes in prices for medicines and medical equipment. The Iranian healthcare system, struggling under sanctions and inflation, is seeing drug shortages and soaring costs that have severely restricted access to treatments. Iran's predicament starkly contrasts with the Gulf states' robust investment. It highlights how sound economic management and engagement with global trade, as seen in Egypt, UAE, and Qatar, are integral to ensuring a stable pharmaceutical supply. Across the region, there is a clear thrust towards localizing pharma production and innovation. Countries are investing in manufacturing capacity, regulatory reform, and public-private partnerships to reduce reliance on imports and to create high-value biotech jobs. For example, Saudi Arabia and Oman, though less in the news this week, have ongoing initiatives to attract vaccine production facilities and generic drug plants as part of broader diversification plans. Meanwhile, private sector players in Bahrain and Jordan are exploring niche areas like medical device innovation and clinical trials, supported by government facilitation. This week's developments thus reflect a broader regional trajectory. The Middle East is leveraging its capital, strategic location, and growing scientific expertise to become not just a consumer of pharmaceuticals, but a competitive producer and innovator in biotech and medicine. If sustained, these efforts will improve medicine security at home and could make the region an emerging exporter of health solutions. Always a critical discussion is public health challenges and disease outbreaks. Persistent public health challenges were evident across several Middle Eastern countries, often exacerbated by conflict and infrastructure issues. In the Gaza Strip, a serious humanitarian health crisis deepened. On August 25, an Israeli airstrike hit Nasser Hospital in Khan Yunis, one of Gaza's major medical facilities, with devastating consequences. The strike and a follow-up blast killed at least 20 people, including 4 health workers and 5 journalists, and injured many others. Palestinian health officials reported that medics and reporters rushing to the scene were caught in a second explosion. Israel's military acknowledged striking the area and expressed regret, calling it a tragic mishap, while announcing an inquiry. The incident drew international condemnation and underscored the extreme dangers facing healthcare staff and patients in Gaza. Coming amid ongoing hostilities, the loss of medical personnel and damage to hospital infrastructure further cripples Gaza's already overstretched health system. Aid organizations warned that famine conditions and outbreaks of disease could worsen if health services continue to be disrupted. The Gaza crisis illustrates how conflict-related violence directly spawns public health emergencies, from trauma care needs to the risk of communicable disease in overcrowded shelters. In Syria, the conflict may have ebbed in intensity compared to prior years, but its public health impacts remain profound. Marking World Humanitarian Day on August 19, WHO highlighted that 31 attacks on healthcare were confirmed in Syria so far in 2025, with 5 health workers killed in the line of duty. Clinics, ambulances, and supply warehouses have been targeted, leaving large swathes of the country with fragile health services. Syrian humanitarian workers shared harrowing testimonies of treating patients amid active violence, for instance, doctors in Aleppo recounting emergency surgeries in a hospital that had just been bombed. These accounts drive home the point that Syria remains one of the world's largest humanitarian crises, with 16.7 million people needing health assistance and 7.4 million internally displaced as of this month. Overcrowded displacement camps with poor sanitation continue to breed diseases. Syrian and international agencies are on high alert for cholera, which saw a resurgence in parts of Syria and the wider region in 2022 to 2023. Indeed, Yemen, another conflict-torn state, is currently experiencing a major cholera uptick. Although outside our specific week, data from this summer showed a sharp increase, with nearly 18,700 new cholera cases and dozens of deaths in Yemen in June 2025, an 87% jump from previous months. The collapse of Yemen's water infrastructure, only half of health facilities function, and millions lack clean water, has allowed cholera and other diarrheal diseases to spread, putting especially children at risk. Beyond conflict zones, other public health concerns also demanded attention. In the Gulf, extreme heat and climate-related health risks persisted through August. Gulf countries like the UAE ramped up seasonal campaigns to prevent heat exhaustion and heat stroke among outdoor workers. The UAE's Ministry of Health and Prevention had recently completed a multi-phase heat prevention awareness drive earlier in the month, reaching thousands of labours with education and cooling services. Such initiatives are critical as the region endures record-high summer temperatures that can be deadly without proper precautions. Additionally, non-communicable diseases, NCDs, remain a silent challenge across the Middle East. High rates of diabetes, hypertension, and obesity continue to strain health systems. For example, Bahrain and Kuwait both reported ongoing efforts to improve lifestyle factors and nutrition. Kuwait's new school canteen regulations, announced in late August, aim to provide healthier food options to combat childhood obesity. Meanwhile, Lebanon's public health indicators are deteriorating due to its economic collapse. Essential medicines are scarce and expensive. More than 70% of the population has been pushed into relying on the Ministry of Health for care as private insurance lapses. Out-of-pocket health expenses in Lebanon have soared to over 85% of total health spending, and many patients simply forego treatment. This week saw continued reports of medication shortages in Lebanon, including for chronic and life-saving drugs. The situation is compounded by an exodus of medical professionals. Hundreds of Lebanese doctors and nurses have emigrated or left the public sector since 2020, undermining health service delivery. In Iran, too, public health is imperiled by systemic issues. The country's ongoing economic turmoil drove the Iranian rial to near collapse in late August, and Iranian media warned that the prices of medicine and medical supplies are set to skyrocket as a result. Severe shortages of specialized doctors and nurses have already forced some hospital wards to close in Iran. Such developments mean reduced capacity to respond to everyday health needs, let alone surges from outbreaks or emergencies. Iranian hospitals have struggled with periodic blackouts and supply chain disruptions, which opposition reports say have led to delays in surgeries and rising mortality from treatable conditions. While Iran's situation differs from war-torn countries in that it's driven by sanctions and governance issues, the public health outcome, a population with limited access to care and medicine, is similarly dire. Overall, the region's public health challenges this week highlight a sobering reality: gains in health and wellness can be rapidly undermined by conflict, economic instability, and infrastructural breakdowns. International support and strong humanitarian interventions remain vital. Whether it is securing ceasefires to protect hospitals, funding cholera vaccination campaigns, or shoring up collapsing health systems in Lebanon and Iran, a concerted effort is needed to address these crises. Without such measures, the progress seen in other spheres of health development could be offset by these enduring vulnerabilities. Wellness and health promotion is continually developing. Let's discuss. Health and wellness promotion efforts maintain momentum across the Middle East, emphasizing prevention, healthy lifestyles, and community well-being. The week included several initiatives targeting different aspects of public health awareness. In Jordan, a novel approach to wellness was integrated into addiction rehabilitation. The Ministry of Health, with WHO support, inaugurated a new fitness and well-being facility at the National Center for Rehabilitation of Addicts in Oman on August 20. This facility, part of a regional substance use prevention initiative, provides patients with exercise equipment and wellness activities, recognizing the role of physical health and routine in supporting recovery from addiction. A healthy body aids a healthy mind, is the guiding concept. Jordanian health officials noted that engaging recovering individuals in sports and fitness can improve mental health outcomes and reintegrate them into a positive community environment. The project aligns with broader wellness trends in the region, where mental health and lifestyle medicine are becoming key components of public health strategies. Several Gulf countries also celebrated health promotion days and campaigns. In the United Arab Emirates, August 28 marked Emirati Women's Day, and health leaders used the occasion to highlight women's contributions to healthcare and society. The UAE Minister of Health, Abdul Rahman Al Owais, praised Emirati women as partners in shaping the future and driving positive transformation across development sectors. Celebratory events underscored initiatives in women's health and empowerment. For instance, the UAE's progress in organ donation and transplantation was noted as an area where women have been key advocates and beneficiaries. The country's ongoing public awareness campaigns on issues like breast cancer screening and maternal health were also amplified during the week, reinforcing the message that women's wellness is a national priority. More broadly, the UAE continued its year-round wellness drives. The Heat Exhaustion and Disease Prevention campaign that MOHAP ran through August delivered health education and screenings to thousands of outdoor workers, aiming to prevent heat stress and communicable diseases during the hot months. Similarly, MOHAP's recent anti-tobacco initiative, in partnership with a pharmaceutical company, reflects a preventive approach to combat smoking-related illnesses in the UAE. Saudi Arabia carried out a prominent wellness campaign of its own. The annual Crown Prince's blood donation drive was in full swing. The Ministry of Health urged citizens and residents to donate blood either at one of 185 blood donation centers or via appointment on the Sahati Health app. This campaign not only boosts blood bank reserves, critical for emergency preparedness and surgeries, but also ingrains a culture of volunteerism and community solidarity in health. Saudi officials highlighted that voluntary blood donation is both a humanitarian act and a pillar of the country's Vision 2030 goal of a vibrant society built on social cohesion. The integration of digital tools using the Sahati mobile application to book donation slots further exemplifies how wellness campaigns in the region are leveraging technology to increase public participation. Within days of the campaign's launch, timed around August 22, thousands of donors had reportedly registered, reflecting strong public enthusiasm. Other community-level wellness activities also took place. In Kuwait, the National Campaign for Combating Cancer, CAN, announced the kickoff of its 2025 Summer Hidokan Olympics, a sports and wellness event aimed at promoting healthy lifestyles and cancer prevention among youth. By encouraging young Kuwaitis to engage in friendly sports competitions and physical activity, the campaign tackles risk factors like sedentary behavior and obesity that are linked to cancer and other NCDs. Oman continued its anti-smoking push as well. On August 19, Emirates Health Services, which also operates in northern Oman, reported it had strengthened smoking cessation programs, offering integrated counseling and nicotine replacement therapies to help individuals quit. These programs are combined with public awareness about tobacco's risks, illustrating the region-wide trend of addressing lifestyle diseases through both education and direct support for behavior change. It is also worth noting the rising emphasis on mental health and social well-being in the region's wellness narrative. For example, Bahrain recently signed an MOU with a local NGO, Al-Nawar, and WHO to advance mental health awareness and positive psychology in the community. While this occurred in late July, its implementation phase fell in August. The program includes happiness workshops and stress reduction campaigns under the banner of Empowering Healthier Minds. Similarly, Iran, despite its challenges, saw grassroots wellness movements where civil society groups organized local exercise gatherings and healthy cooking workshops to combat the gloom of economic stress, albeit these often proceed without formal government support. In the West Bank and Gaza, NGOs continue to promote psychosocial wellness for children affected by violence, with activities like art therapy and play days reported this week, small but important efforts to improve quality of life amid adversity. Collectively, the wellness and health promotion efforts highlight a preventative, community-centric approach taking root across the Middle East. By focusing on healthy habits, preventive screenings, and social determinants of health, these initiatives aim to reduce disease burden long-term. They also foster public engagement in health, whether it's donating blood, participating in a fun run, or simply being mindful of one's diet and stress. The week's developments show that even as governments handle acute crises, they are also investing in the proactive cultivation of healthier communities, which is essential for sustainable development. Always innovating and key to discuss is digital health. Digital health innovation was a prominent theme, as countries continue to integrate technology into healthcare delivery and administration. In Oman, the Ministry of Health underscored its digital ambitions by hosting the Doha Forum for Health Digital Transformation on August 26 to 27 in Salalah. Under the theme, Digitization of Health and Innovation, Towards an Outstanding, Sustainable Healthcare Service, this two-day forum convened officials, IT experts, and industry partners to chart the next steps in Oman's e-health journey. Demonstrations at the forum included applications of telemedicine in remote regions, pilot programs for electronic health records linking government and private providers, and discussions of using AI for predictive healthcare analytics. The event signals Oman's commitment to modernizing its health system through technology, ensuring even the most far-flung communities can access quality care. Omani health leaders called for greater public-private collaboration in digital health, recognizing that a robust tech ecosystem, inclusive of startups and global tech companies, will be needed to implement these innovations on a national scale. Saudi Arabia also showcased notable digital health progress. The Saudi Mo's blood donation campaign highlighted the successful use of the Sehati mobile app to facilitate public health efforts. By allowing users to book blood donation appointments and find nearby centers via their smartphones, the Sehati app continued to demonstrate the kingdom's broader e-health strategy in action. More broadly, Saudi Arabia has been a regional leader in adopting digital tools, from AI chatbots for COVID-19 information to drone-based delivery of medicines during Hajj. This week, the Health Minister's international outreach provided an opportunity to share these successes. During his New Zealand visit, digital mental health platforms pioneered in Saudi Arabia, which have provided millions of virtual counseling sessions domestically, were discussed as exportable models for collaboration. Saudi Arabia's integration of telemental health and its virtual hospital initiative, linking specialists to patients in rural areas via telepresence, have earned global attention. The fact that mental health apps and telecare were key topics in bilateral talks shows how digital health is now a core component of health diplomacy and knowledge exchange. In the United Arab Emirates, known for its smart government approach, digital health news this week included ongoing enhancements to national health information systems. The UAE's Riyati platform, a nationwide electronic medical record system, continued onboarding private clinics in August to create a truly unified patient record accessible across facilities. Additionally, Abu Dhabi's Malafi Health Information Exchange, the first of its kind in the region, reached near-complete participation by hospitals, meaning clinicians can instantly retrieve a patient's medical history from any Emirate facility, improving safety and efficiency. While these developments were cumulative and not tied to a single dated event, officials at Abu Dhabi's Department of Health noted during recent conferences that such digital foundations enabled quicker rollout of services like e-prescriptions and AI-assisted diagnostics during the pandemic. This week, health tech executives in Dubai also prepared for the upcoming 5th Future of Healthcare Summit, scheduled for early September, with a focus on AI in healthcare regulation and precision medicine. Pre-summit briefings indicated the UAE will announce new guidelines on employing AI algorithms in clinical settings, aiming to be a model for healthcare regulation with AI, a vision articulated in mid-August and closely watched by the global health tech community. Qatar leveraged digital solutions to enhance primary care access. The Primary Healthcare Corporation, PHCC, in Doha announced on August 22 the opening of a new urgent care clinic at Al-Wajba Health Center, and notably, it has integrated digital triage and appointment systems to manage patient flow. This clinic, and 12 others like it across Qatar, uses a centralized digital platform so that patients can visit any urgent care location regardless of which health center they are registered at. The PHCC affirmed it would continue expanding such services year-round, in line with community needs, while enhancing quality of care. Qatar has also seen success with its new El-Bay patient app for managing appointments and accessing teleconsultations. As of late August, the app recorded a strong uptick in user adoption since its launch a month prior. Thousands of patients have used El-Bay for services like medication refills and virtual follow-ups, reflecting the community's readiness to embrace digital health conveniences. Finally, on a regional cooperative level, digital health was a key topic in cross-border initiatives. The WHO YMAO simulation exercise on migrant health, held in Cairo, August 18 to 20, emphasized the need for real-time cross-border communication systems for disease surveillance. Representatives from Egypt, Libya, Sudan, and Tunisia recommended establishing standardized digital platforms to share health data about population movements and outbreaks. Such proposals, raised in the simulation's closing on August 25, if implemented, would leverage digital tools to greatly improve early warning and coordinated response for public health events across borders. It exemplifies how digital innovation in health is not just within countries, but also increasingly connecting countries, a vital development as populations move and health threats transcend geographic boundaries. In summary, the Middle East's digital health innovation this week demonstrated a mix of national achievements and collaborative aspirations. Countries are rapidly digitizing their health services to improve efficiency and access, from Oman's e-transformation forums to Saudi and UAE's AI initiatives, and the public is responding positively. These advances are laying the groundwork for a future where quality healthcare in the region will be augmented by data-driven insights and technology, making it more personalized, preventive, and accessible. The challenge and opportunity ahead will be to ensure these digital solutions are inclusive, benefiting urban and rural communities alike, and secure, and that healthcare providers are trained to maximize their potential. Finally, we have population health management. Population health management efforts to improve health outcomes for entire groups and communities was a key focus area, with countries launching initiatives targeting specific populations and leveraging data for better planning. One major theme was the health of students and youth, given the imminent start of the new academic year. In the United Arab Emirates, Emirates Health Services, EHS, announced it had completed comprehensive preparations for the 2025 to 2026 school year, aiming to ensure a safe and healthy environment for students. EHS, which oversees health services in hundreds of public schools, has deployed qualified medical and nursing teams to all 333 school clinics nationwide and stocked them with essential supplies. A back-to-school guide was distributed to parents and students with practical health tips. Importantly, EHS expanded its student health screening program this year, adding new age-appropriate tests to catch issues like vision or hearing problems and early signs of chronic conditions. Last academic year, over 95,000 students received routine immunizations through school clinics under the National Immunization Program. Building on that, the authorities plan to intensify awareness campaigns in schools on vaccinations, nutrition, hygiene, and daily healthy habits to boost immunity and well-being among children. The involvement of families is encouraged. EHS officials emphasized that parental engagement, ensuring kids get enough sleep, healthy meals, and hygiene education at home, is vital to the success of school health programs. The UAE's integrated approach exemplifies population health management by proactively keeping the nation's youth healthy, thereby reducing future disease burden. Syria's immunization program receives a boost as UNICEF delivers refrigerated vaccine trucks, strengthening cold chain capacity for reaching children nationwide. In Syria, despite conflict, population health efforts continued in the form of immunization strengthening. On August 28, UNICEF handed over 3 new refrigerated trucks to Syria's Ministry of Health, a milestone in bolstering Syria's vaccine cold chain. Funded by Gavi, these modern vaccine transport vehicles will safely ferry vaccines from central stores to clinics across the country, including hard-to-reach areas. The Syrian Health Minister Dr. Musab Al-Ali lauded this as a real difference for children and families, noting that a resilient cold chain ensures life-saving vaccines remain potent when they reach every community. Since January 2025, over 475,000 Syrian children have been vaccinated as part of ongoing campaigns, and UNICEF support, which includes rehabilitating 170-plus health centers and deploying mobile health teams, is crucial to maintain and improve that coverage. By focusing on equitable vaccine access even amid instability, Syria and its partners are practicing population health management that averts outbreaks and protects child health on a large scale. Similarly, in Iraq, immunization and surveillance initiatives took a leap. The country launched fieldwork for a national school-based student health survey, the Global School Health Survey, earlier in the year, and this week the data collection phase was wrapping up. The survey covers behavioral health risks among adolescents, like dietary habits, physical activity, and substance use, and its results, once analyzed, will guide Iraq's interventions for youth health in coming years. Managing migrant and refugee health emerged as another population health priority. In Cairo on August 18 to 20, representatives from Egypt, Libya, Sudan, and Tunisia, all countries with high migrant flows, engaged in a WHO-led simulation to improve cross-border public health coordination for migrants. By the exercise's conclusion, reported on August 25, these governments called for standardized health procedures at borders and formal agreements between neighboring countries. They specifically recognized how displaced populations often face overcrowding and poor sanitation, which heightens disease risks for both migrants and host communities. Recommendations included setting up joint surveillance for outbreaks among mobile populations and ensuring migrants have access to basic healthcare without fear or delay. This reflects an understanding that population health management must extend beyond one's own citizens to anyone residing in or moving through a country. In practical terms, Egypt and its neighbors are looking to harmonize vaccination programs, for example, making sure a refugee child gets the same immunizations on either side of a border, and to share health data, so that, for example, a cholera case in a border town is swiftly communicated and contained on both sides. As conflicts and economic crises drive more migration in the region, such collaborative population health strategies are increasingly important. Yemen, with one of the world's largest humanitarian crises, saw a small but positive step in population health through its cooperation with Jordan. Beyond the high-level agreement for medical treatment mentioned earlier, Yemen's government this week coordinated with WHO and other NGOs to distribute nutritional supplements and hygiene kits in internally displaced persons (IDP) camps, targeting tens of thousands of at-risk children and pregnant women. While overshadowed by other news, these on-the-ground interventions in Yemen, vitamin A supplementation, cholera oral vaccines, and water purification tablets, directly address population-level vulnerabilities and prevent excess morbidity among those groups. Health cluster bulletins from late July, published August 29, indicated that by end of August, Yemen had recorded over 100,000 suspected cholera cases in 2025, and partners were intensifying hotspot mapping to focus resources on the worst affected communities. This is population health management in action, identifying high-risk locales and deploying measures like sanitation drives and mobile clinics to quell the disease spread. The approach is not individual but collective, aiming for community immunity and improved environmental health. Meanwhile, wealthy Gulf states also took preventive steps for specific population segments. Kuwait's Ministry of Health, as noted, kicked off a national health survey campaign on August 27. The survey will statistically sample households across Kuwait to assess prevalence of risk factors, such as smoking rates, dietary patterns, chronic disease incidence, among the population. The awareness campaign encourages public participation, informing residents that by contributing their health data confidentially, they help shape future health services and policies. Kuwait's MOH also this week reinforced regulations for school canteens to provide healthier food options, limiting sugary drinks and junk food, directly targeting the student population's nutrition. And in Iran, though facing systemic woes, some provinces implemented community health volunteer programs. In Mashhad, health workers launched a door-to-door campaign in late August to educate families on preventing household COVID-19 and influenza spread ahead of the fall season. This echoes Iran's past successful use of BEVARs, community health workers in rural areas, a classic population health approach that other countries like Oman and Bahrain have also adopted in their primary healthcare models. Overall, this week's activities underscore a critical shift in the region toward proactive population health management. There is a growing emphasis on collecting and using health data, surveys, dashboards, to guide interventions, segmenting the population, students, migrants, etc., to tailor health programs, and focusing on preventive care at the community level. By intervening early, whether through school health programs, immunization drives, or risk factor reduction, Middle Eastern health authorities aim to improve health outcomes broadly and reduce inequalities. The challenges are still significant, especially in countries with instability, but the strategies being deployed show a recognition that the health of a population is only as strong as its most vulnerable groups. Managing health at scale, therefore, is moving to the forefront of the regional health agenda, promising more efficient, inclusive, and preventive healthcare in the future. Let's summarize this week's review. This week's health and wellness developments across the Middle East paint a picture of dynamic progress tempered by formidable challenges. On one hand, many countries forged ahead with ambitious reforms, innovations, and collaborative ventures. Health authorities are clearly prioritizing policy measures to enhance care access and affordability, exemplified by Qatar's broad pharmaceutical price cuts and Kuwait's adjustments to healthcare eligibility, as well as investing in the future through national strategies like Iraq's Women and Children's Health Plan and Egypt's export-driven pharma roadmap. These initiatives reflect a shared regional commitment to strengthening healthcare systems, aligning with broader social and economic visions, such as Saudi's Vision 2030 and the UAE's national agenda. Equally, the region demonstrated a rising profile in research, biotech, and digital health. Qatar's Sidra Medicine pushed the envelope on genomics, Oman and the UAE convened thought leaders on digital transformation and AI in health, and multiple countries expanded telehealth and health IT platforms for more integrated care. Such moves indicate that the Middle East is not just consuming medical advances but increasingly contributing to them, positioning itself as a growing global player in health innovation. Public health and wellness promotion efforts added to this narrative of progress. From Jordan's innovative approach to addiction recovery through fitness, to Saudi Arabia's successful mass blood donation drive via a health app, to the UAE's multifaceted campaigns on heat safety, tobacco control, and women's health empowerment, there is a distinct momentum toward preventive care and healthy living. Communities are being engaged through awareness campaigns, school programs, and the leveraging of technology to encourage healthier behaviors. These efforts are vital in addressing the region's high burdens of non-communicable diseases and in cultivating a culture of wellness that complements clinical care. Population health management initiatives, such as the UAE's comprehensive school health safeguards and Syria's immunization outreach with international support, underscore an understanding that long-term health outcomes improve when entire populations are systematically protected and served. Notably, regional cooperation emerged as a key theme. Countries are increasingly working together on issues like migrant health, medical training exchanges, and knowledge sharing in pandemic preparedness, recognizing that health challenges often transcend borders and are best tackled collectively. Looking ahead, the key opportunities and imperatives for the Middle East's health sector become clear. Investment in resilience is paramount. Countries need to build health systems that can withstand shocks, whether pandemics, conflicts, or economic turbulence. This entails diversifying supply chains, for medicines and vaccines, training and retaining healthcare workers, and strengthening primary healthcare as the first line of defense, lessons reinforced by this week's successes and setbacks. Technology and innovation will continue to be game changers. Those nations that harness digital health tools effectively are already seeing dividends in efficiency and reach, and others will need support to catch up. The collaborative spirit shown in joint exercises and bilateral agreements should be nurtured into more robust regional health networks, possibly under the auspices of bodies like the Gulf Health Council or the Eastern Mediterranean Regional Office of WHO, to share resources and respond collectively to threats like epidemics or climate-related health crises. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.